Well, as we bring in the new year, come January 1st, we'll be seeing some new policies across the province. Of course, the big story is minimum wage, set to go up $14 an hour on New Year's Day, but there will also be some changes to sick leave. Starting January 1st, workers across Ontario will be entitled to a minimum of 10 emergency personal days, 2 of them paid. And the boss will no longer be allowed to ask you for a doctor's note for those sick days.
I think that's sensible. As we know, when you're sick, you should be staying at home. You shouldn't be going to the doctor to get a note. You can spread the disease. You also are wasting time in the office it's really not necessary. And while maybe some people may abuse this new policy and take days off when they shouldn't, I think most people are honest, and you can trust them. Employers should trust them, so it's a good move.
The province is also making changes in the workplace when it comes to dealing with employees or their children who may experience domestic or sexual violence. Those workers will be able to receive up to 17 weeks off without fear of losing their jobs, and the first 5 days must be paid. And January 1st will also bring big changes to the way people under 25 access prescription drugs.
The new program will provide access to over 4,400 drugs to individuals 24 and under. And the beauty of this is that it's actually free of charge. There's no deductibles, there's no copays, and there should be very few barriers to individuals to get access.
4 million children and young adults will be eligible for the province's new pharmacare program, regardless of their income or if they already have private insurance. And it also means they'll have free access to programs like smoking cessation counseling.
Smoking cessation counseling. At this point in time, at this moment, only seniors and those individuals who are covered under social assistance have access to counseling services paid for by the Ministry of Health. Now we have a much greater ability to reach young smokers and prevent the damages of smoking.
The Liberals' pharmacare plan was included in this year's provincial budget. It's expected to cost about $465 million each year. And another provincial policy change will be impacting smokers in the new year. As of January 1st, smoking outside hospitals and psychiatric facilities will no longer be allowed as part of the Smoke Free Ontario Act.